I'm your student nurse today, performing hand hygiene, maintaining patient privacy. Can I have your name and date of birth, please?
Sam Johnson, something XX.
Perfect. That matches your wristband and the patient chart. So, Sam, how are you feeling today?
Pretty good.
Okay, I saw that you're here because you took a fall.
Yeah.
Okay. How are you feeling after that? Pretty much the same?
Yeah.
Okay. We do have some orders in the MAR for you that I'll go over in just a second, but it says that you don't have any allergies in your chart. Is that still right?
Yes.
Okay. And if any of that ever changes, if you just want to let us know, that would be great.
Okay.
Perfect. So we do have some Fluzone and some heparin ordered. Can I just talk you through that really quick, see if you want to take those?
Yeah.
Perfect. So that Fluzone, that's just your yearly flu shot. Helps prevent you from the influenza virus. Is that something you might want?
Yes.
Okay. And just for that, at the injection site, which we will do your arm, but it can also go in your thigh or your upper, basically your upper butt. But you can have some muscle aches and tenderness at the injection site. Sometimes it feels sore, and sometimes you can have a low-grade fever. Is that still something you want to do today?
Mm-hmm.
Okay. And then also that heparin, we can give in the arm, the abdomen, or the thigh. We're probably going to give it into the abdomen today, but I will double check that. That's just for help blood clots, to help prevent that, and then we don't want it to lead to DVT or diverticulitis. Is that something you're also interested in today?
Yeah.
Perfect. Just with that, you do bruise and bleed a little easier, so just keeping an eye on that, and if anything it seems abnormal or excessive, just to let us know, okay?
Okay.
Perfect. I will go grab those meds if that is everything you're okay with, okay?
Yes.
I did perform a full head-to-toe assessment and a vitals check, and everything was within normal limits. And he has had labs drawn beforehand. I will go grab those meds, okay?
Okay.
So now I'm in the med room. I am performing hand hygiene. I can see his patient MAR for Sam Johnson. We can see that he has Fluzone ordered, which is the 0.5 intramuscular injection, which I can do in the arm, the thigh, or the upper butt. It is 0.5 milliliters. You can see that it is 5 milliliters for IM injection. It is not expired, and so it's the right dose. It is ordered for now. It is the right route. The indication is that it says yearly influenza vaccine, and the indication is that he agreed to have it to prevent that influenza. And we are gonna go for the upper arm because for intramuscular, and that's where we agreed. He's about 145, 5'4" average build, so that will work for that. Then we also have our heparin, which is 5,000 units per milliliter, and we want to see that he has 5,000 units ordered, so we will draw up 1 milliliter. We can see that it is heparin. It is ordered for now. It is not expired. It is for a subcutaneous injection, so we are going to do the abdomen about 2 inches from the belly button. We can also do it in the thigh or the arm. Indication is to prevent blood clotting and everything with that. We already went over the side effects that he might have with that, and he was still agreeable to take the medication. So now we are going to perform hand hygiene and then put on some gloves. When we start with our injection, we always want to, we're going to start with the Fluzone. And when we start with that, we are going to go onto the top, and we are going to do that. And while I'm cleaning, I am just going to go do another med check with this one to have my second med check. So we do see that it is the influenza virus vaccine. We do see that it is 5 milliliter for IM injection. And we can see that it is the same. It is due now. It is for his yearly dose, and the vial is not expired. So after I scrub the top for 15 seconds, then we are going to make sure to let it dry. So then we are going to grab our syringe. And once I can actually open the package, we are also going to grab the blunt needle, which is how we are going to draw up our medication. So then we can remove the cap, and we can see that he has 0.5. So we are going to draw up for 0.5 of air first. And then you can see that. I'm going to insert and then we are just going to make sure that there is none that and prime just to make sure. And then we are going to use the one cap method to make sure that we do not hurt ourselves. And then you can see here that I have 0.5 drawn up in the vial. Now with that, I am going to label it. I do not have a marker on me right now, so I don't get my medications mixed up. I'm going to put this put on over it just so I know that this is the Fluzone, just to make sure I do not administer each medication. Now with this, before we go into the room, we are going to do this 23 gauge 1-inch needle for the flu vaccine, just because it is going straight into his arm. And we are going to take off the blunt needle, and we are going to discard that into that, and then we will do this. And then this is ready for administration once we get into the patient's room. And then for this heparin, sticking to me. And then for this heparin, again, we have 5,000 units per milliliter. You can see that ordered is 5,000 units a milliliter, so we will draw 1 milliliter. It is ordered for now. It is to prevent blood clots. It is not expired, and it is through a subcutaneous injection. So again, I am just going to clean the top of that for 15 seconds. Perfect. And then I would let it dry for 15 seconds, and then I will prep my syringe. And then again, we're just going to use that blunt needle, and that's how we're going to draw it up, just because we want to limit the infection risk as much as we can. Okay, and we're going to make sure you draw up 1 milliliter of air. Okay, and then we are going to draw. And then we are going to do that one cap method again, because we do not want to poke ourselves. And then you want to make sure there is no air in that. And then you can see I have 1 milliliter drawn up of the heparin. And just again, so I don't mix them up, I have the tape on the Fluzone just to make sure. And I am going to switch that needle, of course, again. So before I even open that, I'm going to take this off, and I'm going to get rid of it into the shelf container. And I will open this, the safety needle, that is 25 gauge 1 inch, and then the heparin is also ready. And now we are ready to go back into the patient's room. Hi, Sam. Performing hand hygiene, maintaining patient privacy. Can I have your name and date of birth for me, please?
Sam Johnson 18XX.
Perfect. That matches the patient wristband. Are you still good to have that heparin in that Fluzone?
Yes.
Okay, and you remember those side effects and everything we talked about earlier?
Yes.
Perfect. And then I will get that ready for us. I am going to grab another pair of gloves, and then we will get that all taken care of for you. Okay, and just for my last med check, I have everything pulled up on the computer in the patient room. We have Fluzone scheduled for now, which is just that yearly injection. We can see that it is the right dose, which is that 0.5 milliliters through a intramuscular injection, which we will be doing in the arm, and everything is prepped there. And that is just for his yearly flu vaccine. So I am going to make sure I scan that flu zone. I'm going to scan the wristband. That's your patient match. Scan that, which you can see is the flu zone, 0.5 milliliters, intramuscular, due at 0700. And we are going to give the match, give the med because it is a correct patient match. And for this, you want to rub for 15 seconds in a circular motion going out. Just make sure that is all clean. And then again, I know that this is my flu zone because it has that tape on it. So you're going to remove the cap, move that back, and then you're going to use the Z method, which is basically just pulling the skin back. Okay, and you want to go at a 90-degree angle, go in, inject the medication. And then you pull right back out and you let go, making sure that nothing's leaking out and that if there is bleeding, you would put pressure and a Band-Aid on it. And then to safely close the cap, you're going to do the table method, and then the safety is in check. You're going to automatically get rid of that and take care of it. How did that feel? Is that okay?
Yes.
Perfect. Are you ready for that heparin?
Yeah.
Okay. And then for my last med check, we do have that heparin. We have 50,000 units per 10 milliliters or 5,000 units per milliliter, which is the order we want to give that 5,000. We can see that I have 1 milliliter drawn up here, and that everything there is good. And so it's the right dose. It is scheduled for now. That is for the blood clots, just to prevent the DVT. And everything with that. We are going through the abdomen, which the patient has agreed to because it is a subcutaneous injection, which we will do at a 45-degree angle. Is it okay if I pull your blanket down?
Yeah.
Okay. And I'm going to pull your gown up as well. Maintaining patient privacy the best I can. So I can see that this is good since their average build at this 45-degree angle instead of going at a 90-degree is going to be okay. Then I will once again scan the patient wristband, which is a patient match, and then I'm going to scan my medication just to make sure that it is all the right documentation and that I did not do. So you can see that is 1 milliliter subcutaneous due now, and that this is his daily med. And then we have already gone over all of the side effects and everything like that. Okay. So once again, I am going to go a little bit below the belly button. We are going to scrub from the inside out just to make sure that everything is nice and clean and make sure everything is good there. And we're going to remove the cap of the needle. You're going to pull apart to make the skin tight, and then you're going to do it at a 45-degree angle, and then you're going to inject the medication. And then you want to give this normally over 10 seconds. And then you pull out and release the medication. Then you are once again going to use that safety method of doing this just to make sure that nobody gets poked and you get rid of that right away. Okay, let's cover you back up, okay? Do you feel anything right away, or are you feeling okay?
I'm feeling okay.
Okay. I am just going to stay with you for 15 minutes, monitor to make sure there are no side effects or anything. Is that okay with you?
Yeah.
Perfect. 15 minutes later. How are you feeling?
Good.
Okay, perfect. I'm going to come back, check, do another head-to-toe assessment, check your vitals and everything in about 30 minutes, okay?
Okay.
Perfect. Patient is in full safety. Bed is the lowest position and call light is within reach. "30 minutes later. Hi, can I have your name and date of birth?
Sam Johnson 18XX.
Perfect. Maintaining patient privacy, performing hand hygiene. How are you feeling, Sam?
Pretty good.
No side effects from that medication or anything?
Nope.
Perfect. Is there anything I can do for you right now?
No, I'm okay.
Okay, perfect. Then I will leave you be for a little bit, but you make sure to call if you feel anything that feels off or you need help or anything, okay?
Okay.
Perfect. I will see you later.